Understanding irritable bowel syndrome is an important step to managing your condition. Here is everything you need to know in less than 5 minutes. So, you've been told you have IBS and you're wondering, is this real? Are the symptoms all in my head? Am I stuck with this pain forever? Your pain is real, and in the next 5 minutes I will explain what this condition is. I'm Dr. Hussenbux. I'm a consultant gastroenterologist in Buckinghamshire, and I see patients with IBS almost every clinic. IBS is common. It affects up to 15% of people. Today I want to change your mind into how you think about the condition, because understanding what's happening is the first step to feeling better. So the first thing to say, which is really important, is IBS is a disorder of bowel function rather than structure. What we currently know is that the gut and brain communicate with each other via the enteric nervous system. Just imagine you're about to give a really important speech to hundreds of people. You might feel a bit sick. You might have a loose bowel motion. That's basically your anxious brain talking to your gut and then leading to the symptoms that you're experiencing. So patients can have a trigger. This could be physiological, like severe gastroenteritis, or psychological, such as severe stress and anxiety. This leads to an abnormal communication between the brain and the gut, leading to normal sensations feeling painful. This term is called visceral hypersensitivity. To diagnose IBS, we look for specific symptom patterns. We then classify your IBS into either diarrhea, constipation, or alternating bowel habits. Finally, we arrange some blood tests and stool tests to clinch the diagnosis. Now, this isn't just stress or imagination. We know that there are real, measurable changes that happen in IBS. Your gut might have subtle inflammation that we can't even see on regular tests. Immune cells, called mast cells, sit close to nerve endings and they trigger pain signals. Your gut microbiome, which is filled with your own individual millions of bugs, they look different too, with less diversity and fewer bacterial species in patients with IBS. So why did you get IBS? Well, several factors increase your risk. Women are twice as likely to develop IBS, partly due to the hormones. Any age can get IBS, however, it typically occurs in patients aged 20 to 40. If you've had gastroenteritis, you have a 30% risk of developing IBS after the infection. Early life stress and anxiety and certain medications, especially antibiotics, can play a factor. Well, here's the good news. Understanding these mechanisms means that we can give you a personalized approach to make you feel better. We can identify your trigger foods by keeping a diary, stress management, and incorporating exercise and breathing and meditation to calm down the gut-brain axis. We can also use medications to calm down that neural pathway between the brain and your digestive system. Probiotics might help, exercise certainly helps, and we can see that there's emerging research looking into the gut microbiome and mast cells. IBS is complex, but it's absolutely real. While we can't cure it just yet, most people can have significant relief with the right approach. I'd be delighted to review you in clinic to provide a tailored management approach.